Hi, this is Dr. Tom, and I want to wish you a warm and happy holidays for the upcoming holiday season. My team and I have worked really hard this year to help as many people as we can, and we're really excited, more excited than ever, for 2024. We have so many amazing technologies that we're getting ready to deploy that will allow us to help more people than ever before. One of the technologies I'm really excited about is this new sort of gadget called Firefly. It's kind of like an adhesive strap, and this adhesive strap goes just below, say, your knee on a peroneal nerve, and what it does is it electronically stimulates the muscles of your lower leg to increase the venous return. So basically, think of it as it's kind of like electrically stimulating the muscles that help pump fluid back up from the lower body. Now, why would I recommend this particular tool? Well, I was first exposed to this tool watching basketball players and other athletes use it after recovering from a heavy workout. So, for example, athletes that are squatting or doing some heavy training, they sometimes get a little bit of fluid accumulation in their lower body, so they could just relax, and this guy basically pumps the fluid back out of their lower body. I then looked at some of the data on this particular device for people that have deep vein thrombosis and other conditions. There's a variation of the same device that has, it's more for the medical market. And so I looked at the data on both sets. I was like, wow, this has a lot of usefulness in helping to increase circulation in people. And one of the things that most people don't think about is a lot of times when your fluid pools in your body, it traps all this inflammation. And that inflammation can exacerbate pain in your joints, that's your ankles, your knees, your hips. It could also make it harder to move and make you stiffer. So what I did basically is I put this on, I left it on for about 30 hours, so basically the full length of the battery. And what I noticed is that I had dramatic improvements in my ability to ambulate and walk. And so, so this will be one of the technologies that we'll be introducing to the patients at our center, and then they can just pick these up and put them on as they need it to increase circulation in your lower body. Second thing I want to share with you guys is there's this new technology for whole body neuromuscular electrical stimulation. This technology is called Neuro. Was developed by some friends of mine, and been really excited once they brought this to my attention. So basically, think of it as kind of like almost like a spandex-like material, has these electrodes under all the major muscle groups, and the therapist has like an iPad for a controller, and you can control all the different major muscles of the body. So we could stimulate everything, or we could stimulate just one or two muscle groups at a time. And where I'm going to be integrating this within our center is first we'll be using it with people that have frailty, so basically people that don't have a lot of muscle, they can barely stand. And we're going to be using this to stimulate muscle protein synthesis so we can help them add muscle to their bodies much more quickly. Second area that we're going to be integrating this is people that have spinal cord injury. We're going to actually put this on and try to stimulate as much muscle activity in their body to help give them that opportunity to start to ambulate again. We have specialized harnesses, either with thick chains or webbing, or we have bands. And the idea with the harnesses, it keeps people upright so they can't fall down. And now as we stimulate their muscles electrically, I could put them in a safe environment so they could walk on a treadmill while I'm actually stimulating the muscles that are going to be involved in walking. And the third one, and probably the one I'm most even excited about, is as many people know, we developed this technology to exercise people while they're breathing oxygen. We've taken it to a whole new level. There is no center in the world that has accomplished as much as we have in the exercise with oxygen therapy space. We've got more data than anyone on how to use that to stimulate natural killer cells and cytotoxic T lymphocytes. And we actually have evidence now of multiple people using this technology, and then we can't find any evidence of cancer in 2 to 3 weeks once they begin just doing the exercise protocol. And now we're going to do to take it even to another level is we're now going to integrate this Neuro technology. So imagine, if you will, you're on an elliptical device, so you're using your upper body and your lower body. At the same time that you're using all 4 limbs, I have this suit on you and I'm stimulating all these muscles. So I'm getting way more muscle contraction, more neuromuscular electrical activity than ever before. And so now what I could do is I could dramatically improve your ability to stimulate muscle protein synthesis. So if we time the delivery of amino acids and some proteins to your body as you're working out, we could dramatically improve muscle strength. Now keep in mind, even before we introduce this technology, we already have cancer patients doing dumbbell rows with over 100 pounds. No other center in the world can make that statement except our center. So the idea of someone having cancer and being weak, we're throwing that out the window, and now we're going to make people that are stronger than ever and that can handle the burden of any disease. And as part of that process, we're going to be electrically stimulating the muscles, and we're going to introduce, for the guys that are even stronger, we're going to introduce some blood flow restriction training. So give us 6 months and we're going to start sharing ridiculous outcomes that no one else has ever seen before in the history of planet Earth. So as you can tell, I'm really excited, and I hope that after you guys hear this video message that you're excited as well. And I really invite you to tell everyone you can they just need to come to Causenta to get healthier than ever before.